Velcade is the first FDA-approved treatment from a class of medicines called proteasome inhibitors. Velcade is an effective treatment for patients with multiple myeloma and is given intravenously. The function of proteasomes is to break down proteins in both healthy and cancerous cells. Velcade works by attempting to block or slow down the activities of proteasomes. If Velcade keeps proteasomes from working effectively, a buildup of proteins in the cells can occur. This buildup may lead cells to stop growing and die. Velcade was FDA approved for previously untreated patients with multiple myeloma based on a large international clinical trial that studied Velcade plus melphalan prednisone compared to melphalan prednisone, or MP, alone. The 682 patients in this study had not been previously treated and were not considered to be suitable for stem cell transplant. The trial showed that patients on the combination of Velcade plus MP did significantly better than patients on melphalan and prednisone alone in several clinical measurements. Overall survival, or OS, measures the percentage of patients alive over time. At 16.3 months, 87% of patients taking Velcade plus MP were alive versus 77% on MP alone. The percent of patients who had a measurable improvement of their disease, the overall response rate, was also compared between the two treatment groups. 69% of patients on Velcade plus MP had a response by 16.3 months, compared to 34% on MP alone. Another clinical measurement was time to progression, or TTP. TTP is the time from study entry until a patient shows signs of disease progression. Patients who were taking Velcade plus MP showed first signs of progression at an average of 20.7 months, compared to 15 months for patients who were taking MP alone. Finally, progression-free survival, or PFS, was compared between the two treatment groups. PFS is the time from study entry to first sign of disease progression or death, whatever comes first. On average, for patients taking Velcade plus MP, their multiple myeloma failed to progress until 18.3 months, compared to 14 months for patients taking MP alone. In another large international clinical trial, Velcade was studied in 669 patients who had been treated for their myeloma and relapsed. In this study, patients receiving Velcade were compared to patients taking high-dose dexamethasone. At 8.3 months, 85% of patients taking Velcade were alive versus 75% on dexamethasone. 38% of patients on Velcade had a response to treatment by 8.3 months, compared to 18% on dexamethasone. Patients who were taking Velcade showed first signs of progression at an average of 6.2 months, compared to 3.5 months for patients who were taking dexamethasone. Please remember, every patient's experience with any medication may vary. Your results with Velcade may be different from those seen in clinical trials. Like many cancer medications, Velcade is prescribed in cycles. The duration and number of cycles depends on whether or not the patient has been treated before. The medication is given as an intravenous injection in your doctor's office. The office staff will help you schedule and keep track of your appointments. It is crucial that you and your doctor communicate openly during your treatment to assess how you are doing. Before starting each Velcade cycle, your doctor will carefully evaluate blood and urine tests to monitor your response to the medication. This monitoring should provide your doctor with a clear indication of how Velcade is working for you. If you are having any side effects, your doctor may change the dose of Velcade, temporarily stop your treatment, or take you off Velcade. It is important to continue your treatment as long as you are not experiencing side effects and you and your doctor agree that it is in your best interest. Once your prescribed course of therapy is complete, your doctor will discontinue Velcade injections. All medications have side effects, and Velcade is no exception. It is very important that you contact your doctor if you think you might be experiencing any of them or anything else out of the ordinary, so he or she can help you manage them. An important side effect your doctor will be watching for is peripheral neuropathy. This is a condition that affects your nerves and may cause a burning sensation or pain and numbness in your hands and feet. At times, these symptoms can be severe. In patients with multiple myeloma, peripheral neuropathy can result either from the disease itself or from treatment. The majority of cases of peripheral neuropathy caused by Velcade are sensory in type, meaning it causes some tingling and a loss of feeling. But neuropathy can affect motor nerves as well, and this may result in weakness. Even if your symptoms are easy to live with at first, it is important that you let your doctor know as soon as you experience any of them or if your existing neuropathy becomes worse. By catching peripheral neuropathy early, doctors can usually treat it while keeping patients on their Velcade therapy. In clinical trials of Velcade, 64 to 74% of patients who developed neuropathy showed improvement following a decrease in their dose or discontinuation. Other side effects of Velcade may impact your blood counts. This may cause problems such as anemia, risk of infections, and easy bruising or bleeding. Velcade may also lead to tiredness, dizziness, or fainting. Do not drive any vehicle or operate any dangerous tools or machinery if you experience these side effects. You may also experience nausea or vomiting and diarrhea or constipation. Be sure you're drinking plenty of fluids to help avoid dehydration or hypotension. If the problems continue, you can talk with your doctor about ways to manage them. While taking Velcade, some patients develop a viral infection called herpes zoster or shingles. Your doctor may consider treating you with precautionary medications to help avoid this complication. Please contact your doctor if you develop a painful rash or blisters. Sometimes Velcade may cause more significant side effects, such as heart failure and lung disease. Let your doctor know immediately if you experience shortness of breath, cough, or swelling of the feet, ankles, or legs. You should also speak to your doctor immediately if you experience a convulsion, persistent headache, reduced eyesight, or an increase in blood pressure. Your doctor may make adjustments to your Velcade regimen, or it might be necessary to stop treatment altogether. If this happens, your doctor will discuss other treatment options with you. Be sure to let all of your doctors know about any other medications or supplements you are taking. If you're on an oral anti-diabetic medication, you should check your blood sugar frequently and let your healthcare team know of any unusual changes. Pregnant women should not take Velcade, and women who may become pregnant should use an appropriate method of birth control. You should not breastfeed while taking Velcade.